Hi, I'm Christina Villella. I am a digital health technical advisor with JSI.
Okay, Christina, so I'm going to ask you, what are some digital health trends that you are particularly excited about end of 2022 as we turn the corner into next year? What's on your mind?
That's a great question. I think there's two things. Well, that I'm really excited about. And one, actually, I was just sitting in a presentation where the team from the Ministry of Health in Indonesia was presenting on all of this work they've done of really building up their health information exchange. And I use exchange there and not system because they really have brought together 70 different systems. I came in at the part of the presentation where they were showing the regulations that they've had to pass. And I think we talked so much about governance for I don't know, the first few years I came to the conference, governance, strategies. And now I'm like, oh, wait, yes. So who is actually doing that? They actually passed laws so that now they can use their EMR. So I think that that's really exciting to see these things actually like being implemented and operationalized, and they're not just things written in a strategy. We need to have a law. We need to make sure we're following regulations, but they're actually doing that. I think the second trend I'm really excited about is just really the focus on equity in the digital health space. And I think I think this conference is a testament to that and how we organize it this year, being a hybrid conference. So really trying to still make sure that we had virtual participation and that those who weren't able to be here in person, although we miss you all, could be part of this. But that also, we had the workshop on Sunday on women in digital health leadership. We had a whole session on that earlier today. And just seeing people talking about equity in their work when they're just talking about their projects and like really being inclusive, I think that is really exciting to me.
No, I would agree. I would echo those comments, and I'm just grateful to you all and the organizers for really leaning into the virtual. We've got 1,000 people, you all joining us virtually, who couldn't get here because of travel, who had really challenging other commitments that made this impossible. So the ability to create space for this shared journey, whether you're here in person or online, is really exciting, and I commend you all for doing that from an equity standpoint. Okay, so are there any JSI projects you mentioned Indonesia, and it sounds like that's kind of big picture, something you're excited about, but is there anything you're working at JSI that you want folks to know about?
Yeah. No, I'm working on a lot of different projects. I will not list them all off. But that work I was talking about in Indonesia is CISU, the Country Health Information Systems and Data Use Project. So really excited about all the work they're doing, strengthening country health information systems across the globe. But then one project that's near and dear to my heart is our Cure TB program in Kyrgyzstan. Okay. And we are working to improve TB services there. And the team was asked by the NTP, the National TB Program, to develop TB medical information systems. And in Kyrgyzstan, they don't really have a big focus on health information systems. So our team kind of was starting from scratch. But they've built this amazing EMR and a TB register and a lab information system that all talk to each other so that patients who are getting care either at the primary level and then get escalated to inpatient level and who have to send their tests, we're actually seeing that we're improving the quality of care, which I think is something that we really want to see in this space. And sometimes we don't always see that because maybe it was designed for data collection. But these were actually, because there's not an emphasis on information systems necessary as big of an emphasis, they really are focused actually on the patient care and just developing them for business processes. So I went and talked to clinicians there, and they're like, I asked them about the system, and they just tell me please don't take it away. Don't leave, because it's just really reformed how they're providing TB care.
So Christina, any parting wisdom for folks who are watching live? I know you're hiring a lot on your teams at JSI, so maybe that's something worth mentioning. But anything else you want to leave folks with? Other impressions from the conference that are exciting you?
That's a good question. I would just say, keep watching. Don't lose. Keep logging in. We're all really excited that you're watching us virtually. I know sometimes the speakers don't even realize that we're streaming for whatever reason, but we're really excited that you're here. And yeah, please do continue to engage in the content and visit the virtual posters and all the. And I don't know if we have any virtual exhibit booths this year, but just keep visiting all the content and engaging. And we look forward to seeing you again in 2023.
All right, thank you so much, Christina. We appreciate you coming by.